Thank you for taking the time to watch this short training that we've put together on the prescription drug plan coverage changes for 2025. As your broker, I invest actually extra time and extra money above and beyond what Medicare requires to be part of a prescription drug program called Strategies for RX Savings, because I want to help my clients get the best prices and maximize their coverage options. So that program is something I want you to understand that is in addition to all the training that I have to do for Original Medicare to be able to offer you Medicare plans and prescription drug plans. I am a part of this program, and we're actually trying to educate people in advance of this next annual election period about what changes are coming and how to be mentally prepared for those changes. Please listen to this whole video all the way through, as it is really important. I'm going to have some instructions later on for us to be able to work together this fall during the annual election period. So back in August of 2022, Congress signed into law the Inflation Reduction Act, which makes significant changes to healthcare policy in the United States. It was created as a way to try to lower the cost of prescription drugs for Americans on Medicare. But it's more complicated than that. So when dealing with drug manufacturers, pharmacy benefit managers, and health plans, which are primarily for-profit businesses, it makes it complicated to enforce and enact this new law. So we're going to break this down for you so that you get an understanding of what is coming in the years ahead. Some of you have been clients of mine for 7 years now, and I just don't want there to be any surprises next year when you start seeing the changes and it's not lining up with what you're expecting, because you're hearing it's going to lower costs across the country, but you are not seeing these lower costs. So again, this is just a preliminary introduction to how the costs are going to be shifting for 2025 prescription drug coverage. Now, 2025 plan models and pricing do not get released to the public until October 1st of this year. So I don't have access to that information, and I'm not allowed to share it with you before October 1st. But since this information we're going over is just part of the 2022 law that was passed, we can at least go over this part and get a better understanding of what's coming up. And I do want to let you know that we are going to be doing things a little bit differently for annual election period this year. My goal is to get a list of all of my clients' current prescriptions before the end of August, so that I can now head into annual enrollment doing drug plan reviews for all of my clients. And then also, if you have additional friends or family who would like to have a licensed agent do a drug plan review for them, I'm just highly encouraging people to reach out and get help this year in particular, because people are going to be heading into quite a shock if they're not prepared in advance for the changes. Now, all of you should be getting an annual notice of change from your current prescription drug plan and current Medicare Advantage plan in late September. So you're going to get an idea of kind of what's changing about the plan through that form, which again is called an annual notice of change. But if you're confused about the changes, or you want me to just review your drugs, make sure they're still on the formulary for the plan that you have, that is the time to do that, is that annual election period. And as we get closer to that time period, there will be more communications from me. So just keep your eye out. And if you can respond as quickly as possible, we could make this a smooth transition for you into 2025. So this goal of this presentation is certainly not to scare you or upset you. But the goal of it is just to educate you early so that you understand the importance of doing a prescription drug plan review with me during this next annual election period. We just want to make sure that your coverage for 2025 is the right fit to cover your prescriptions. And there's going to be some major changes to how prescription plans are covering drugs for 2025. So educating you early just allows you to make a level-headed choice during the next election period without feelings of anger or frustration, anxiety, or fear. So again, the annual election period does start October 15th and runs through December 7th. And we are expecting a significant percentage of Medicare beneficiaries will need to do a drug review this year, so they're not blindsided in 2025. Not everyone that you know has a licensed agent that they're working with. So I highly encourage you to share this video with your friends or family if you think that it will be a benefit. A lot of people just go on Medicare.gov and do their own plan review, but we're not thinking that this would be a good year to DIY. So they're going to want a guide, especially someone who has extra training in prescription drug coverage. Now, these next two slides that we're going to go through will demonstrate the shift in cost from Medicare and from the Medicare beneficiaries that require a lot of medications or expensive medications. The cost is going to be shifting from Medicare and from Medicare beneficiaries over to the insurance carriers who provide those standalone Part D prescription drug plans and drug coverage that may be embedded in your Medicare Advantage plans that come with RX coverage. Now, Medicare was built on a foundation of cost sharing. In the past, the cost for prescription drugs was shared between Medicare, the Medicare recipient, the insurance company, and the drug manufacturer. The cost is shared among those parties. But with the Inflation Reduction Act, Medicare is going to be paying way less than what they have been paying in the past. And they're trying to force these costs for the prescription drug costs onto the Medicare plan and the manufacturers of the drugs. And unfortunately, the plan and the manufacturers will not survive if they don't in turn pass those new cost burdens onto the Medicare beneficiaries in the form of maybe higher monthly plan premiums or restricted plan benefits. So that's what we're going to talk about. So let's dive into this. Now, this is a chart done by the Kaiser Family Foundation, and it shows in graphic form what has been changing. So back in 2023, the breakdown of the plan coverage was divided into stages. You have the deductible stage, and in that stage, the Medicare beneficiary was 100% liable for all drug costs. And then they would transition to the initial coverage stage. And then if they had expensive prescriptions or a lot of prescriptions, they may then transition into the coverage gap or donut hole. And then finally into catastrophic coverage. So in 2023, the Medicare beneficiary was liable for, again, 100% in the deductible phase, then 25% of the drug costs in the initial coverage phase. And in that phase, the plan was liable for 75% of the drug costs once the member went into that initial coverage stage. And then once the Medicare beneficiary moved from the initial coverage stage to the coverage gap, the plan was then only liable for 5%. The Medicare beneficiary was liable for 25%, and the drug manufacturer is responsible for 70% in the form of a drug discount. So if the Medicare beneficiary is on very expensive medications, you can see that the Medicare beneficiary is only liable for 5% of the cost of the drugs the rest of the calendar year once they get into that catastrophic phase. And then the insurance company was responsible for 15% in the catastrophic phase stage. And the Medicare program, as in the federal government, Medicare itself, was liable for 80% of the costs of drugs in the catastrophic phase. Now in 2024, we saw a small shift in liability. The deductible stage is still there, where the Medicare beneficiary is still responsible for 100% of costs in the deductible stage. And then the initial coverage stage and catastrophic stage remained similar to 2023. However, in 2024, if a Medicare beneficiary ended up in the catastrophic stage, their cost share went down to 0. And the drug plan was forced to absorb the 5% that the recipient was paying in the prior year. So as you can see for 2024, if a Medicare client hits catastrophic, it was likely that they spent upwards of $3,250 for their prescription drug copays up to that point. But going forward through the catastrophic stage, they would be done with cost sharing for the year, and 100% of their drug costs would be covered by the plan and Medicare. For 2025, there is a huge change to the out-of-pocket maximums for Medicare clients. So the Medicare beneficiary is still liable for 100% of the deductible stage, and then 2025 deductibles cannot be more than $590, but some plans like Medicare Advantage plans or some more expensive standalone prescription drug plans may have a lower deductible, but they cannot have a higher deductible than $590 for the drug portion of your coverage. Now, the Inflation Reduction Act has shifted some of the costs in the initial coverage stage to be shared between the drug plan, the manufacturer, and the Medicare beneficiary. So you can see in the initial coverage phase for 2025, the Medicare beneficiary is liable for 25% of the cost of their drugs. The plan is liable for 65% in this initial coverage stage. And then the drug manufacturer is liable for 10%. So that they basically completely eliminated the coverage gap stage. So once a Medicare beneficiary hits their $2,000 max out-of-pocket threshold, they're done with cost sharing for the remainder of the year. And of course, this is something that we want to celebrate for you, that you're limited to just a $2,000 out-of-pocket cost for your prescription drugs. And isn't that awesome? But the reality of it is that now in the catastrophic coverage phase, the drug plan goes from only being liable for 20% of the cost now to in 2025 being liable for 60% of the cost of Medicare beneficiaries' drugs in that catastrophic phase. Yes, I said that correctly. Medicare is going from an 80% of the burden this year to only 20% of the burden next year in that catastrophic phase, and they're shifting the rest of the costs to the plan and the manufacturer. This is a huge change. They are decreasing how much they are paying and how much the Medicare beneficiaries are paying, but they do limit the Medicare beneficiary liability to only $2,000 in out-of-pocket expenses towards drug costs. Now, in an ideal world, the plans and the manufacturers would absorb this liability, right? Yeah, it's going up significantly for them in the back end. But in reality, these are not nonprofit businesses. And insurance companies are generally for-profit businesses. And in most cases, they have shareholders that they have to answer to, and they're not going to want to reduce their profit margins to absorb these extra drug costs that Medicare is now shifting over to them. So how are they going to handle this? Well, there's going to be, just like if oil prices go up, then the cost of gas goes up. If shipping prices go up, then the cost of goods goes up, and so on. It all ends up going downhill to the recipient. So that's what we're going to talk about now. Granted, I do not have a crystal ball, but it's just basic economics. We live in the United States, and we still have private companies that are not government controlled. That's just not the way that we do business here in the States. So here I want to show you just a timeline of that cost shifting. This is just another demonstration of where the shift of the cost has gone. As you can see in 2023, it started with drug coverage expansion to start covering vaccines like the Shingrix shot for shingles. That normally goes through Part D. So you would get the shot at the pharmacist, and in prior years, that drug would have been charged as a Tier 3 prescription drug, which is the brand name tier, usually subject to your plan's deductible first and then higher cost sharing because it's a Tier 3 drug. So if that's a 2-shot series, if someone wasn't able to get both shots in the same calendar year, they could be subject to that deductible twice, one for each year, plus the copay for a Tier 3 drug. But now they have changed the law. So for 2023, they reduced the cost of adult vaccines that are on the advisory committee on immunization practices. But someone is paying for those vaccines, and it's likely that cost was passed on to the drug plans. So they've done a good job of absorbing those extra drug costs for 2023, because as brokers, we didn't see a huge change in premiums in the 2023 plan years. And in 2023, they also reduced the cost of insulin to $35 per month supply of a covered insulin product. Now, covered means it's on the drug plan's formulary. If it's not on the plan's formulary, it's not covered, especially not for $35. So you'll want to make sure that you check the plan formularies, or you have your broker check for you to make sure that your insulin will be on the formulary for next year, because those formularies can change each year. Now, this doesn't include other diabetic drugs that are not insulin. So things like the GLP-1s, like Ozempic, Wegovy, Mounjaro, those are not capped at $35 copay for a month's supply. Sometimes there are other programs, though, that we can look up for you that can help with the cost of drugs that are not capped by the insulin savings program, which is why I belong to the Strategies for RX Savings program and why I pay extra monthly to have access to their resources. Now, 2024, the big change that we saw was that instead of the Medicare beneficiary being responsible for 5% cost sharing in the catastrophic phase, it went to 0 cost sharing once the Medicare beneficiary reached that catastrophic phase. For 2025, of course, the biggest change is limiting Medicare beneficiaries' max out of pocket to just $2,000 for the year. And that really lowered the catastrophic phase. This year, it was an $8,000 max out of pocket, and 2025, it will be a $2,000 max out of pocket. So they've completely eliminated the coverage gap, like we mentioned, or the donut hole for 2025. So that will not even be a stage going forward. Additionally, that enormous transfer of liability from Medicare, which was paying 80% this year, to the plans carrying that weight, and now Medicare is only responsible for 20% in that catastrophic phase. You have to just ask yourself, who is paying for this? That cost was transferred to the plans and the drug manufacturers, but there's nothing in place to stop them from passing the cost burden on to the consumer in different ways. Now, the plans have to date done a great job of absorbing those changes and not passing that cost on to the Medicare beneficiary in the form of increased premiums or other means that they have available to pass that cost on. So this is just an example of a few of the changes due to the enactment of the Inflation Reduction Act. This is going to affect both standalone prescription drug plans, like those standalone Part D plans that you would pair with your Medicare supplement, and Medicare Advantage plans with drug coverage included. They have no choice but to change benefits and pricing in order to absorb these new costs. It will likely hit the standalone prescription drug plans harder because the standalone drug plans are not subsidized as heavily by Medicare. Of course, when you're on original Medicare, Medicare itself is financially responsible for 80% of your healthcare costs. But if you opt into a Medicare Advantage plan, the plan is responsible for that cost share. Because the plan is now responsible, Medicare does pay a monthly per capita stipend to the Medicare Advantage plans to be able to manage your claims and provide your coverage. And Medicare doesn't tell the plans how to use that stipend or how to allocate those funds, so they can use it for healthcare, but they also have been using it to add in extra benefits on the Advantage plans like dental, vision, and hearing. We do expect that Medicare Advantage plans will try to keep their premiums as stable as possible, but in order to cover those extra drug costs that they're now liable for, you're going to see fewer plan benefits. Of course, they still have to cover at least what Medicare Part A and Part B cover, but we might see a reduction in the extras in order to fund the prescription drug changes inside of the Advantage plans. Now, unfortunately, the standalone prescription drug plans work primarily off of premiums. So they don't get a bucket of money from Medicare to spend on drug costs. Sadly, the fallout that we expect to see from the Inflation Reduction Act is going to be higher premiums on standalone prescription drug plans, and unfortunately, fewer plan choices as more and more plans realize that it's no longer a profitable line of business to be in. Again, we won't know for sure until October of 2024 what the plans and pricing will look like for 2025. Another prediction for prescription drug coverage in 2025 is stricter formularies. This is where it's especially important to have a licensed agent help you with your drug plan review. What's covered today may not or may be covered on the plan formularies for 2025. But as soon as those formularies are published, we're going to be scrutinizing them with our team to make sure that we get you the right fit for your coverage for next year. Additionally, more drug utilization reviews, or otherwise known as hurdles, will be enforced. So these things include prior authorization, step therapy, and quantity limits that will be brought on by the plan to control costs, and especially on Tier 3, 4, and 5 prescriptions. They may even drastically reduce the brands that are covered by their formulary in each drug class in order to control costs. Prior authorization is where the plan has to approve your use of that specific drug before they agree to cover it. And they may say no in the future if they don't think that it's medically necessary for you to take that specific brand name if there's a generic available. Step therapy is where, for example, there's 2 medications that work on your particular disease, but one of those is $500 and the other one is $5,000. So the plan may require you to try the $500 option first. And then if you and your doctor can prove that that $500 option doesn't work for you in managing your disease, then the next step would be to go to the $5,000 option, but they're going to require that you pass the, first step and say, nope, this really doesn't work for me before they allow you to go to the next step. So just to dive into these a little bit further, if you have a standalone prescription drug plan, I would expect for next year to have higher monthly plan premiums in 2025. You may have heard, there's like rumors that go around that the plans are capped at a maximum annual premium increase of 6%, but that is actually not true. There is no cap on how much they can increase their plan premiums. So we might still see some 0 premium plans in the Medicare Advantage space, but we're going to have to see how this new law affects the plans in 2025 and beyond. Again, we are not allowed to talk about plan premiums or plan details until October 1st, and we maintain compliance with that rule. We're just educating and preparing our clients in advance so that when we gather your list of prescription drugs, we can run those reviews as quickly as possible for you and then let you know if you need to make any changes or if you're good where you're at. So right now we're just preparing in advance. You're going to get a request from us in August to send in a current list of your prescriptions and providers so that we can start researching plan options for you. Again, we're going to start hearing about plans over the summer as each carrier rolls out their 2025 plans. And then we're going to keep preparing for those. I'm already getting notices of plans that are dropping out of certain markets. Again, I'm not allowed to share that information yet, but we will help you with this transition. So don't be afraid or anxious. This is meant just to prepare you mentally for what's coming. Now, as we talked about, formularies will be stricter and leaner on the lower cost prescription drug plans, versus the higher cost plans. So we can review the formularies to make sure that you're sufficiently covered, doing our best to guide you in the right direction when it comes to plan formularies. There are 6 protected classes, and every drug is in a class. The 6 of these classes that you see on the slide here are the ones that are protected. That means that Medicare says that the formulary must include most drugs in that category. It doesn't say all drugs in that category, it says most. So that does not mean that your plan will cover your specific brand or name of drug. All the other drugs classes that are not listed on this slide, Medicare just stipulates that there's 2 drugs in each category that must be covered. It doesn't say what drugs that have to be covered. It just says that 2 need to be covered. So in 2025, the plans are very likely going to cover the 2 cheapest drugs in each category in order to manage their costs. So what do I want you to be aware of is all the dynamics of all the cost shifting and how it's going to impact the options that you have in 2025. So if you're on a standalone drug plan, let me know your budget for your premiums so that I know what plans to look for and what plans to recommend to you. And I'll do my best to find savings on your prescription drugs with whatever strategies I have available. We can look at Canadian pharmacies, manufacturer assistance programs, patient assistance programs, and state pharmaceutical assistance programs on your behalf. And another reality is that you're going to have to be more flexible and more open-minded. So a lot of you have prescriptions that you've been using for years and they work really well for you. But if we need to make changes in order to save you money or get a plan that covers most of your prescriptions with a few minor tweaks, we'll have to work together to make that happen. Again, I want to just cover utilization management. This involves the use of prior authorization, step therapy, and quantity limits. This will be brought on by the plans to control costs, especially again on those tier 3, 4, and 5 prescriptions. They may even drastically reduce the brands that they cover in each drug class because of a need to control costs. And as we discussed, prior authorization and step therapy is most likely going to be in the cards for most Medicare prescription drug plans. I want to thank you for taking the time to listen to this entire presentation. I know it was 30 minutes of your time that you sacrificed, but please pass this information on to your friends or family who are on Medicare, especially if you know that prescription drug costs are a big factor in their budget. While we are excited that the Inflation Reduction Act is reducing the out-of-pocket limits for Medicare beneficiaries to just $2,000 per year, we also understand the economic implications of this new law. Nothing in life is free, and for-profit businesses are not the bad guys in this equation. The Medicare drug plans and Medicare Advantage plans were designed to bring competition into the health insurance space. And they all want to be as attractive as possible to get your business. But at some point, if the industry doesn't look profitable or attractive to be in, they will leave, and then we'll be left with fewer choices, worse choices, and more costs to bear. So please keep your eyes open for emails from me in the next couple months so that we can work together to make this a great transition to 2025 with no surprises.